Hi, cell death. Cell death is basic principle of this pathology. The morphologic hallmark of cell death is loss of nucleus, which occur via nuclear condensation, pyknosis, fragmentation, karyoresis, and dissolution, karyolysis. The two mechanisms of cell death are necrosis and apoptosis. Necrosis is death of large group of cells followed by acute inflammation due to some underlying pathological process. So, for example, nerve damage or denervation or ischemia problem, emboli or thrombosis. Neurophysiologic, divided into several types based on growth feature. Growth pattern of necrosis, coagulative necrosis, is necrotic tissues that remains firm, cell shape and organ structure are preserved by coagulation of protein, but the nucleus disappears. Characteristic of ischemic infarction of any organ except the brain. In brain is liquefactive necrosis. Part of infarcted tissue is often wedge-shaped, pointing to focus of vascular occlusion and pale. Red infarction arises if blood re-enters a loosely organized tissue, for example, pulmonary or testicular infarction. Liquefactive necrosis is necrotic tissue that becomes liquefied. Enzymatic lysis of the cell and protein result in liquefaction, characteristic of brain infarction. Proteolytic enzyme from microglial cell liquefies the brain. The basic role of the lysis of brain tissue is microglial cell. And abscesses, proteolytic enzyme from neutrophil liquefied tissue. Pancreatitis, proteolytic enzyme from pancreas liquefied parenchyma. Gangrenous necrosis is coagulation necrosis that resembles mummified tissue. Dry gangrene feature point 1.7. We see it later. Characteristic of ischemia of lower limb and GI tract. If superimposed infection of the tissue occurs, then liquefactive necrosis ensures wet gangrene. Caseous necrosis, soft and friable necrotic tissue with cottage cheese-like appearance, combination of coagulating and liquefactive necrosis, characterized of granulomatous inflammation due to tuberculosis or fungal infection. Example of red infarct is testis. 1 second, is testis and dry gangrene and caseous necrosis in patient with tuberculosis. Fat necrosis. Fat necrosis is necrotic adipose tissue with chalky white appearance due to deposition of calcium, characterized of trauma to fat, breast, and pancreatitis-mediated damage of peripancreatic fat. Fatty acid released by tract to breast or lipase pancreatitis joined with calcium via a process called saponification. Saponification is an example of dystrophic calcification which calcium deposits on that tissue. In dystrophic calcification, the necrotic tissue acts as a nidus for calcification in the setting of normal serum calcium and phosphate. Metastatic calcification are as opposite to dystrophic calcification, occur when high serum calcium or phosphate levels lead to calcium deposition in normal tissue. For example, hyperparathyroidism leading to nephrocalcinosis. Fibrinoid necrosis is necrotic damage to blood vessel. Leaking of proteins includes fibrin into vessel wall results in bright pink staining of the wall microscopically, characterized by malignant hypertension and vasculitis. Thank you.